Hi, this is Tyler and Robert again. Now we're going to help teach y'all how to take a proper blood pressure reading. So, at the clinic, we have chairs, such as this one that Robert's on. Could you show him the chair really quickly? Here we go. So notice that sit back down for me, Robert. Notice that the chair does have a backrest on it, and we also have the patient's feet on the ground. Sometimes we can't always have ideal conditions when taking someone's blood pressure, but in our clinic, this is what we have. We also will have tables, so we'll be able to support the patient's arm on a table. And now let's start taking our blood pressure reading. First thing that you want to do is make sure that the blood pressure cuff that is inside your blue box actually fits the patient. If your patient is particularly big or small, we have other cuffs that we can use. Just come to one of the coordinators like me or Robert and ask us. First thing that we're going to do is we're going to get the range of which we need to pump up the sphygmometer. So first thing I'm going to do is I'm going to take Robert's pulse. And when I can feel his radial pulse, I'm going to start pumping it up until I can no longer feel it. When I can no longer feel it, that is roughly where his systolic blood pressure will be. But just to be safe, we're always going to pump it up 30 more than that whenever we do take his blood pressure. So we'll pump. All right. So I stopped feeling his pulse at 140. So now when I take his blood pressure, I'm going to pump up 30 more than that, which would be 170. And I'm going to listen to his brachial pulse to find that reading. Can you help me show them this? So once you find his brachial pulse, you're going to turn your knob all the way to the right in order to trap all the air into the cuff. Make sure when you're doing this that you're not going to be watching the needle for the actual pulse. You don't record anything that you see, just the things that you hear. So the very first beat and the very last beat. And I'm up to 170. And I release. And when I stop hearing it, I fully release. Then you record it into the chart, and that is how we take our blood pressure at the home clinic. Thank you.